This video is on the brachial plexus dissection. It's a really fun dissection in class. We are going to cheat and just do remove layers. So what I want you to do is keep the bones, go to muscular onto level 7, arterial to layer 1. I want to see the veins and arteries of the neck, and then nervous to only layer 1. And we're going to zoom in on the head. And I added the integumentary system because normally we have to remove the skin as well. So if you want to have some fun cutting, go to the cut tool and cut the skin off. Unfortunately, we're going to have to go all the way down to the arms. That's why we're not going to the head view. So you could actually remove the skin this way. And one more band of skin. And we could even try to remove the platysma. Now the problem with this, see how I deleted everything there? I was having this trouble, I got really frustrated. So if you don't need the therapeutic effects of just cutting everything, let's remove the skin altogether. And we're gonna remove the muscles. So bye-bye platysma, nice seeing you. Sternocleidomastoid, nah, bye-bye. Now as we're doing this, we're gonna rotate it a little bit. The brachial plexus is right there. It's hiding behind the jugular vein and the carotid artery. So watch it as it's coming up. Still hiding. There's biomohyoid. Finally, we can see it. So here are the roots of C5, C6, C7, C8, and T1. We still have muscles in the way, so let's go all the way to muscle layer 2. Now, this is what we would have. And the problem is we have these blood vessels. So what happens in the brachial plexus dissection is we destroy the blood vessels on one side, keep them on the other. So we end up on the cadaver, we'll have one side that will have nice brachial plexus, one side that will have nice blood vessels. So again, I got really frustrated cutting. I was cutting underlying structures. So if you want to try to cut, you can. I'm just going to cheat and use bye-bye. But what I want you to see is we have the clavicle, the subclavian vein and the subclavian artery are going in front and they're anterior to the brachial plexus. The carotid artery and the internal jugular vein here are anterior to the root. So they have to be removed. So let's remove those. And now we can see it. This right here is the vagus nerve. Remember that from our previous video? That is the cervical plexus, by the way. Now, it's up to you. What I would do is I would actually just remove the rest of the muscles in the skeleton to see where they're coming off, and then do your labeling with the bones in place, because you need the bones in place to see where they go. So the brachial plexus is made up of the roots of C5, C6. That's going to form the superior trunk. C7 is a snob. It forms the middle trunk. C8, remember C1 through 7 exit above the cervical vertebrae. C8 is exiting below the 7th cervical vertebrae. And then this is T1. It's exiting below the 1st thoracic vertebrae. It's a nice vertebrae shape right there. They're going to form the inferior trunk. So I'm putting back on my skeleton. C5, C6, C7, C8, and T1. So what I want you to do is label the trunks. So to label the trunks, I'm going to take tools. I'm going to take the label, and there is the superior trunk. There is the middle trunk. And there is the inferior trunk. Let's move that out of the way. So to see what happens, I'm going to remove the clavicle. Again, you're probably going to want to actually do your labeling with it on. But let's remove the clavicle. And again, I spent about 20 minutes trying to actually get in there and just remove it so you could see it cut, but it didn't work. It was very frustrating. So all three, inferior, middle, and superior, are going to have an anterior division. So if I actually click on that, it's going to say anterior division of the brachial plexus. Anterior division, anterior division. Now if I rotate it slightly, I guess we're going to look at this side now. They all have a posterior division as well. Here's the posterior. So they all have a posterior division. Posterior, posterior, posterior. All three posterior divisions, posterior division of superior, middle, and inferior, are going to go into this posterior cord right here. And you need to label that. So tools, label, posterior division. Now, what's going to happen when I go here and turn back around is all my lines are going to vanish. So I just click on that to get the anterior lines again. So we're going to now focus on the cords. So this was the posterior cord. It's coming from the posterior division of all three trunks. Now the anterior division of the inferior trunk is a snob. It doesn't want to hook up with anything. So it's going to become the medial cord. So if I zoom out, let's put our clavicle back on. It is now medial. So these are up and down. This is towards the middle. This is towards the outside. So that is the medial cord. This is the lateral cord. And then this is the posterior cord. So label all three of those. And again, see how I was just moving the labels off to the side. I would probably do all the labeling at once, see how my lines are not there because I keep clicking in and out of the label mode. So if I go back to the label mode, I have to put the labels back on. So that is the medial cord, posterior, and inferior. So we now have our terminal nerves. So we're going to start with the posterior cord. And we have our posterior cord there. Hello, posterior cord. Oops, posterior cord's there. And it's going to give off this axillary. So if I go there, I scroll out on the axillary, I'm going to see it goes behind the humerus. Now, the main branch of the posterior cord is going to be the radial nerve. Guess what side of the arm it ends up on? Radial or ulnar. Dun, dun, dun. So the radial nerve is going to go on the posterior side of the humerus, go to the tricep. Then it sneaks around to the anterior side, and you guessed it, hangs out by the radius. So that is the radial nerve. So what I want you to do is look where all these terminal nerves go. So going back in, zooming in, our medial and our lateral cords are going to hook up to this median nerve. This is probably the best named nerve in the body. It goes down the median of your arm. So if I scroll out, see it's just going down the median of your arm. It's the median nerve. Now, remember that snobic, and that is arise from the merging of the medial and lateral cords. Now, if I scroll in enough and like rotate it a little bit, see that little branch coming out right there. That little branch is going to go to that nerve, and this nerve is going to travel on the medial side of the arm. It's going to go behind the elbow and then hang out by the ulna. What should we call this nerve? Yep, it's the ulnar nerve. Now remember, have you ever hit your elbow and it feels real funny and it's called your funny bone? This is the bone it thinks it's funny. It's the humerus. It's not. Oh, let's see. That ulnar nerve is right there next to the olecranon fossa and olecranon process. That's your funny bone. Okay, there's one more terminal nerve I want you to label. That terminal nerve is hiding out right there. That's the scapula. And it's a very disappointing terminal nerve. It is the musculocutaneous nerve. It is going to go to the proximal humerus. It goes to the brachialis. It goes to the biceps brachii, and cutaneous is skin. So that is the brachial plexus. And let's say hello to our nerve right there. The vagus nerve. I will leave you with the vagus nerve. You don't have to label it. It's just my favorite cranial nerve. So that is the brachial plexus labeling. Thank you.